Greetings and welcome to Arizona's Vision. Dr. Mark Page here, the Chief Optometrist. We're in the Ahwatukee office today, and today we're going to talk a bit about treatment for corneal transplants. So some people have had an accident or they have certain diseases that cause their eye to not function properly. So they may have to actually have the surface of the eye transplanted and then a new one inserted there. So that definitely creates an irregularity and difference in the shape and height. So very difficult to see with traditional glasses or traditional contact lenses. So sometimes we'll create a much larger lens that kind of lands way out here on the edge of the eye, kind of what we call the sclera. So if I kind of modify here, oops, I'm going to switch it to the other way here. So we can see the cornea here. There's our pupil, the cornea, and then the sclera is kind of the white part out here. So we're trying to figure out what is the shape of that. So we can see by this curve that there kind of is a little different curve one way versus the other. And we're looking at in this little line here in this position. So as I move this around, we can kind of see that changes. So the curve is a little different. So now we also see that the anatomy of the eye, the tears, that can also kind of influence the readings that we're able to generate. So particularly if patients had a transplant, those things are magnified. And so sometimes the precision can be impacted by that. So if we do have a situation where we're trying to get a perfect fit and we're not getting the success that we want, there's some new technology that really is kind of the most advanced available out there. So what's done is we actually take, it's almost like a gel, and we fill this little container here, and this is actually placed right onto the eye surface. So once that goes in place, it creates like a mold, like a plaster of Paris. So we really have all the details, all the intricacies of the curves, the shapes, the size by this imprint. So this is actually the iPrint technology. So we're one of the few doctors in the whole United States that have this technology available. So if you're having difficulty, especially if you had a transplant or if you have keratoconus, other conditions, the pellucid marginal degeneration, so this really can help get a much more precise alignment of the lens to your eye, so a lot more comfortable, a lot more wearable, also healthier for the eye, and then clarity of vision, we can try and get that enhanced there as well. So if you're suffering from having a transplant and not getting the vision that you would like, give us a call. We'd love to help you and your family and see if we can get you more comfortable and better vision. So don't delay. Call us today.